We are going to end our health and wellness show today by talking with Patrick Quigley, CEO of Sidecar Health, all about cash pay insurance. Thanks for joining us today. We'll see you tomorrow. Have a great day. Welcome back to Mountain Connections. Right now we are joined by Patrick Quigley, CEO and co-founder of Sidecar Health. We are going to have an important discussion about the economy, finances, as well as your health and how you can save the most money with insurance that makes sense. Patrick, thank you so much for joining us today all the way from LA.
All right, well, thanks very much, Christine, for having me.
So looking forward to this important conversation. It has taken on a whole new meaning, health insurance, finances, since this pandemic. What is the biggest mistake that people make when they are considering their health insurance?
Well, I think the biggest mistake anybody can make around your health insurance and healthcare is to not have health insurance, especially during a pandemic. It's really, really important that everyone makes sure they have the access that they need to care, right? And so that means having insurance, that means getting care when you need it.
And you have a rather innovative model, which is a cash price one. Tell me more about that.
Yeah, we are a completely unique approach to health insurance. In fact, we are the only company offering a health insurance product built on the power of cash. So what exactly does that mean? What we do is when our members pay their monthly premium, we actually give them the cash they need to go buy care directly with doctors. We give them a Visa card that connects directly with our claims account. And why that's really, really important is because it turns out when you buy care directly with the doctor, directly with the pharmacy, and you pay cash up front, it's cheaper. Typically, it's about 40% cheaper. And so that obviously leads to lower costs of health insurance, but doctors love it too because they're getting paid up front. And one thing that's really important to me is it also eliminates surprises, because I don't know about your situation, but I've certainly been in situations where I get surprise bills. And it's really important that individuals know kind of what costs are before they engage the healthcare system, since healthcare can cost so much. And that's how we're different.
It can be confusing that there are different prices for different ways to pay when you go to the doctor, when you get health care. There's prices for insurance companies, there's prices for self-pay. Why is that, and how do you manage that, especially on your own?
That's right. I think healthcare is very expensive and it is very confusing. And what we try to do is make it simple. So what we do, which makes us unique, is that our insurance product is designed to provide a fixed benefit for every single service you can do in the US healthcare system, for every drug that you can actually go and get, every prescription drug. And by making it a fixed payment, it's very transparent. So then consumers can actually go and engage with their doctor and ask the question, hey, I'm coming in for a simple doctor visit, I'm not feeling well. What are you going to charge? And then members can actually just go ahead and pay with their Sidecar Health debit card. And what's neat about it is in our app, you can actually see all of our benefits and what a fair price is for any service you might need. And so when you're engaging with the healthcare system, it's kind of like shopping. Whereas if somebody is charging too much, you know that maybe you should go somewhere else. And if someone is charging a fair price, you know that right away and can actually decide to go and work with that particular doctor. Does that make sense?
It does. So you're ideally saving money, but also you have the power to decide who you want to see, what you want to pay, as opposed to having to defer that to a different company where you really can't make that decision.
That's correct. I mean, one of the things that I always like to joke about is it turns out everybody takes Visa. So by giving people a Visa card that enables people to pull money directly from our claims accounts to pay the doctor, we're actually enabling people to access care where they need it. And that's one of the big challenges in the US healthcare system, and that's networks, right? Is that traditional health insurance products will have very narrow networks and will limit choice. We believe that people should be able to access care anywhere, and that's why we've designed our product in this way. It also has the added benefit of enabling people to shop for care and make their own decisions, as you point out.
Many people are looking at a situation right now where they do not have insurance anymore. Their healthcare costs aren't covered, whether they've lost their job or benefits have changed within their career. So with Sidecar Health, is this available for anyone? Is this a good option for someone who has lost their insurance right now?
Absolutely. So you can come to our website, sidecarhealth.com, and see if we're going to be a good fit for you. I will call out that we're not the best fit for everyone because, as you can get from our name, we put consumers in the driver's seat for their care, right? So you have to be willing to ask your doctor, hey, what's this going to cost? You're going to have to be willing to use our app to know what a fair price is, what benefits are. So it's a really engaged way to get your healthcare, which we think is best, but might not be for everybody. The most important thing is that everybody, if they're transitioning between jobs and such, make sure they get coverage either through us or through other sources. I will say it's been great that the administration has opened up the exchanges right now. So if you are between jobs, that's another place that you can look to go ahead and see if you qualify for a subsidy. But regardless of how you get your coverage, I think it's really important, and we're glad to be part of the solution.
Is Sidecar Health small enough where if you are wondering if this is the right fit for you, or if you have this plan and you have questions about it, where you can call and get someone right away?
Oh, absolutely. We overinvest in our member care team. In fact, our whole member care team is based right there in Utah, along with a few engineers, and we're continuing to invest there. And we have a phone number right on our website that if you have any questions about our product, you can get a hold of a real person 7 days a week that is incredibly knowledgeable about our product and can help you think through if we're going to be a great solution for you.
Patrick, I mentioned this at the top of the interview, but you are the CEO of Sidecar Health, also a co-founder. Why did you decide to become part of this company? What made you decide to start a health insurance company?
Well, it's interesting. Thanks for asking the question. So I think entrepreneurship is oftentimes very personal, right? So I had an experience a few years ago where I needed to go get an MRI, and I got it completed through my traditional insurance and ended up with a bill personally because of where I was in my deductible for $1,300, which is a lot. I had to have a follow-up a few months later, or excuse me, about a month later. Same doctor, same procedure, and since I knew I was going to end up paying for it myself, I asked if I could just pay for it with cash. And it turned out when I paid for it with cash, it was only $330. And so this was just put a light bulb out for me, is that why is it so much cheaper when I pay for things myself? And since insurance is just based on the cost of care, we thought that if we could build an insurance product based on enabling people to access these lower costs, everybody could save on their healthcare. Everyone can save on health insurance. And one of the big challenges for the country is, like, how do we make healthcare affordable and accessible for everyone? And we believe by our product design, we could lower the cost for everyone. And so that led to the creation of Sidecar Health.
And from a business perspective of this, what made you decide to have a lot of your company right here in Utah?
Oh, well, Utah's a fantastic area. I've been very fortunate in the past of working with teams in Utah. So when we decided to build our member care team, it was a really easy decision for us to make an investment to right there in Salt Lake City. In fact, we've got about 20 people. We're a young team already in Salt Lake, and we expect to add another 50 before the end of the year, expanding into engineering jobs in addition to our member care team.
And how has the pandemic affected this company? That might sound a bit like an obvious question, but how has it really changed what you do day to day with Sidecar Health?
I don't think it has changed what we do on a day-to-day basis, but what I do think it has done is it's brought more forward the need for everyone to get access to care, right? There's such a huge uninsured population in the country. I believe in Utah, it's almost 10% of the population. And if you're in the middle of a pandemic, that should cause everyone some concern. And so the one thing that it's done for us is raised awareness about the need for access and coverage, and maybe brought our profile a little bit higher because our product is so affordable and so accessible to everyone.
Patrick, how can we find out more about Sidecar Health? If we have any questions, what should we do? Who should we reach out to?
Well, the best way to learn about us is to come to our website, sidecarhealth.com. And if you have questions, to call into the phone number on the site.
Well, thank you so much, Patrick Quigley, for joining us today from LA. Exciting to hear more about Sidecar Health. Patrick is the CEO and co-founder of Sidecar Health. If you have any questions, be sure to reach out. It's exciting that they're here in Utah and have many of their people serving here in our state. So it's a great option for many people. We'll be back with more right here on Mountain Connections right after this.